Lateral ventricles on each side. They're lateral to each other, right? Interventricular foramen. Third ventricle. The aqueduct to the fourth ventricle. And that's the fourth ventricle. That's it.
Can you do it again?
Do it again.
Lateral ventricles. Interventricular foramen. Third ventricle. Aqueduct to the fourth ventricle. Okay?
Can you point to the foramen again?
Interventricular foramen would be in between the two.
Ah.
Okay? Let me have that brain. Okay, here's a typical sagittal view of the brain. Cerebral cortex, right? This is the cerebellum, corpus callosum. This area would be an area where the thalamus would be. This is a choroid plexus there. And notice how the choroid plexus is coming down. This is the fourth ventricle there. So that's fourth ventricle. Let me have the other half of this brain. So if you notice on the other half, it doesn't show it that well. Some of them allow you to put this all the way up in there. So that's the fourth ventricle right there, cerebellum. So cerebellum, pons, medulla, corpus callosum. Looking at it from the lateral side, cerebellum, temporal lobe, frontal lobe, parietal lobe, occipital lobe. This is pretty highlighted for us right there. That's the central sulcus, precentral sulcus, postcentral sulcus. Cerebellum, medulla, and then it will become the spinal cord as it comes down, right? Pretty simple, right? Keeping it simple as we possibly can. And a sulcus versus a gyri, you could do that, right? The gyri is the top of the mountain. The sulcus are the grooves on the cerebral cortex. Let me point it out. Let me show you again. So, just give me one. So a gyrus or gyri is the top of the mountain, and all these grooves are called sulci or sulcus, right? And there's a central sulcus that demarcates the precentral and to the postcentral sulcus, which is important for somatosensory and somatomotor, right? Okay.
Pre is closest to your forehead.
Pre is before, right? You come
Yeah.
back. Yeah.